Okay, Talofa and Malo Lele, welcome back to our UPIC table, Utah Pacific Islander Health Coalition table. Um, Today, I'm grateful to join you. My name is Luisa Tupou. I'll be the community health worker on the call today. And we are so lucky and blessed to be hearing today from Luti Nonu and Epenesa Skipps. By way of introduction, Luti is the son of Sione Nonu and Latai Wolfgram Nonu and was born in Hawaii. His family later moved to Salt Lake City, where he spent most of his life. He attended Brigham Young University, where he played rugby and was a member of the BYU dance team. Living Legends, where he met his wife, Keakealani Lu Nonu. He graduated in 2020 with a bachelor's of science degree majoring in biology, and is currently enrolled at the University of Utah School of Medicine in the fall of 2020. With 2 kids now, he is looking forward to, with the goal to become one of the first Polynesian cardiothoracic surgeons in hopes to help positively impact the cardiovascular burden felt by the Polynesian community as well as many other populations. Awesome. And we have Epenesa Skipps, who is a mom of 5, happily married, proud Samoan, and oldest of 6. Her parents are Anitsipa and Ana Vaisingano, and the late Ana Vaisingano, who recently passed away about a year ago on January 2nd, 2022, due to colorectal cancer. And so today, that's a good leeway into our topic today. Today on UPIC Table, we will be discussing colorectal cancer. And so we're grateful for Luthi and the expertise that he brings with his experience as a medical student. We'll just get started right into this. And if Luthi, you do need to jump off after your portion, that's totally fine. Thank you for joining us. We know you and Emma's time is so precious. But Luthi, I wondered if you could just first off, please explain for our Pacifica community what colorectal cancer is, and generally what the side effects of colorectal cancer are.
Yeah, I just have this a little slideshow. Is it okay if I show it on the screen while we talk?
Oh, yes, of course.
Okay, let's see if this will work. Okay, so so yeah, I definitely can talk about that, Luisa, but just talking about this topic, colorectal cancer does affect the Polynesian community quite heavily. But to understand it a little bit, I wanted to show a little diagram of what our colon actually looks like. This is obviously just a little cartoon, but our colon kind of what entails all of our colon is what they call the large intestine. So after food comes into our stomach, it gets digested more by the small intestines. It then goes into our colon, which will kind of go up, come back down around, and then go out. The last part of our colon is called the rectum. And honestly, the colon is one of the organs that kind of continues to recycle cells as some cells get old, new cells are continuously growing every single time. So normally our colon actually looks, pretty pink and pretty healthy. But what colon cancer is when some of these cells continue to grow in a way that's not normal. And some of these cells can grow and it doesn't stop growing. So what that can look like can kind of look like these, what they call polyps, or these things that these different masses that kind of grow into our colon wall. We can get into this a little later, but there's different stages of how big these grow and if they're continually growing. But this is essentially what leads to cancer. If there's a little polyp or a little mass that's found pretty early, it hasn't actually invaded this tissue that's at the bottom of that mass. But as that tissue continues to grow and grow and grow to like stage 3 or stage 4, we can see that tissue at the bottom, the colon, it kind of has gotten through now, and it's gone into our lymph nodes and can start spreading to other parts of the body as it has passed through that membrane. Does that answer your question though, Luisa? I want to show some pictures so it's not just all talk.
Yes, you know what? I'm so grateful because I'm actually a visual learner. So I'm sure there's people who will be watching this who can relate. I really, really appreciate the diagrams and the explanations. Like when you develop these polyps or when you start to develop colorectal cancer, are there certain like side effects that can kind of warn you that you may need to go in and get checked?
Yeah. So symptoms, people might be feeling when they have colon cancer. There's actually a lot of them, but I do want to highlight this one at the very bottom that many times people that have colon cancer, they may not even know it at all. They may feel completely fine. They may be completely healthy. Usually, this cancer, usually people don't feel the cancer until it has grown to stage 3 or stage 4, and now it is starting to affect all different parts of your body as it grows in different areas and it spreads to different areas. But even people in stage 1 or stage 0 or stage 2, they may feel completely fine. Some of the symptoms that that we see here are actually many times caused by other things too. So that's important to keep in mind. It's something that to talk with doctors if we feel diarrhea or constipation. You can have gas pains or feel like you're bloated or feel like you're too full. Obviously, these can happen if we just eat too much or drink too much milk. I don't know. But these are symptoms that cancer can also cause. So, some symptoms like diarrhea or constipation, finding blood in your stool, whether that's really bright red blood or if it's dark, almost black, tarry blood in your stools. You may find that some people with colon cancer can sometimes develop really thin stools, so like their stools start to look almost like pencil-like when they come out. That's a symptom that's a symptom that some people with cancer can have as well. And then we talked about the regular gas pains and cramps or not feeling well or feeling bloated or feeling too full, as well as people who have lost weight for no reason. They're not even trying. They might be eating the same amount that they've always ate, but they are losing a lot of weight over a period of months, over a period of 1 to 6 or 12 months. On top of that, they can feel kind of fatigued and feel tired all the time, and they don't really know why. They're sleeping enough, and they're trying to do everything to feel with a lot of energy, but they still feel fatigued and very tired. And then some very not specific symptoms as well include nausea and vomiting. So just to reiterate, a lot of times people don't have any symptoms at all until it's a little too late. But just to answer your question though, Luisa, this is kind of the things that I had prepared.
Oh, I appreciate it. And I feel like it's so hard, we look at these symptoms. There's so many cross things of what could cause some of these symptoms that oftentimes I feel like sometimes it just may go like undetected. Because I know for myself, I may experience nausea or, I wish I could lose weight easily, but I feel like some of these things happen just in everyday life. You could feel gassy anytime. You could feel nausea at any time, and there's a lot of things that can cause that. And so I feel like sometimes these symptoms are, like I said, they could cross over into other things or other reasonings could explain these types of symptoms. And I guess that kind of leads into my next question. In your opinion, why do you feel like our communities are hit so much harder with this kind of cancer?
So I think there's a few different things that might, that could tell us why I think Polynesians are affected more. One, it can run genetically. It can be passed down sometimes if we have certain genes. It might make descendants or family members a little bit more susceptible. They might have higher risk of developing colon cancer. But I included some risk factors here that just as we age, people are going to develop cancer a little bit more. We talked about the family history, that if there's any history of cancer just in general, if a woman has like ovarian or cervical or breast cancer, those are risk factors that can lead to somewhat higher chances of developing colon cancer. And then just a couple things to note, but some diets that are high in animal fats, we love to eat our puaka, we love to eat our sipi and everything. some diets, even diets that are kind of low in calcium or low in folates, some diets that don't have a lot of fruits and vegetables. There's some studies out there that suggest that if we aren't eating all the vegetables or fruits, or if we're low, if we're really high in the animal fats that we eat, those increase the risk of developing colon cancer. And I think that's kind of prevalent in our community sometimes, just diet wise. Cigarette smoking as well can definitely contribute to developing colon cancer. But in answering your question, Lisa, I think there's a lot of factors that contribute. These are just risk factors that increase our risk. But I think one of the things that really affects our community is sometimes we aren't getting screenings or getting into a doctor to address concerns before they start to happen. As people start aging, or as Polynesians start turning 40 or 45 or 50, when they should be going in to see doctors, I think it's kind of hard sometimes for our community to do that sometimes. I know a lot of the older family members, they always are worrying about the younger ones. They're always going to work for their kids and their grandkids. And so I realize there's a lot of confounding factors that make it a little hard for the Polynesian community to take care of themselves sometimes and get these screenings done. But I think overall that those are all kind of ideas that kind of come to my mind in regard to why it might be affecting our community more, but I'm not entirely sure. Those are some thoughts.
Yeah, I kind of was looking up some information before the call too, like just so I could get a little bit like more educated too. And I feel like when I was reading a little bit about colorectal cancer, a lot of it was just talking about how, like you said, a lot of it is like early detection. Like there's a super high percentage, if you catch it very early on, that you can actually recover from colorectal cancer. You can be cured through like a series of radiation or things like that. But something that I did see was that like even something preventative like a colonoscopy is very telling, and I feel like it catches it early on. But like you said, in the symptoms, I've seen a lot that most people don't actually develop those symptoms until like much later, like you said. And I mean, I know for my own family, and I come from a strong Samoan line, I feel like really, unless my grandparents or my own parents currently, um, they were not going into a hospital until they were in extreme amount of pain. Like preventative measures was not really something that I saw. Even my grandparents, and one of my grandmas is still alive right now, almost 90 years old. And I recently asked my mom when I was in preparation for this call, like, "Hey, do you know if grandma got a colonoscopy?" And she's like, she said in someone like, waste of time, and I feel like that's just a very Polynesian thought, like preventative measures that even maybe free, or like screenings may be free and those types of things. It's just like we're a very reactive people. We're not really going in unless we're in extreme amount of pain, or we're not really seeing hospitals. Like you said, oftentimes our health we're trying to provide for our families. Sometimes we're working multiple jobs, and I feel like we allow these reasons to be more important than going in and checking our health out. So I love how you highlight these risk factors, because I feel like that is definitely something that I feel like for our community, like, I mean, this is just for my family, and I'm sure other people can relate, is really they're not going in and like, oh, I'll do the free screening. I talked to my mom about my grandma, and then I mentioned to her, like, hey, my mom's turning 70 this week. And I was like, hey, mama, did you do your colonoscopy? And it's free. She has great state insurance. And she was like, no, don't ask me about that again, like they don't want to ask. Like, I'm being fearful if I ask them about their health. Like, it's crossing a border sometimes. I just feel like culturally, because they don't want to tell us about their health issues. They don't want to worry the family, And so I love that you recognize the symptoms and also risk factors that I feel like make you more susceptible to colorectal cancer. I feel like that's really, really great information, and hopefully can help the folks who are listening to this as well, and will listen to it in the future. Luti, thank you so much for your time. I wanted to introduce Epen. Was there any last thought that you had just to close out your section?
Um, nothing that we really haven't talked about. There's a way to prevent it. Some of the best ways is just to talk to your doctor. Some simple screening tests, like you mentioned, like colonoscopies. There's other tests too. If those things somewhat maybe a little too invasive for some of our community members. There's other tests that may be able to substitute and still give you a good screening and let you know ahead of time. But I guess the one thing I did want to bring up maybe is just a little bit of a prevention things that we can do to help decrease things is avoiding tobacco, increasing our physical activity. In regards to our diet, just including fruits, vegetables, maybe kind of decreasing the amounts of animal fat that we eat, and then just limiting alcohol consumption. These are all different ways to help decrease that that burden of colorectal cancer in our community. But other than that, Luisa, I just want to tell you and you pick as well as Epe, thank you for the time that you guys given me to come and talk with you guys and share a little bit about colon cancer. I know it's affecting our people a little bit more than we want it to. Polynesians are not only sometimes not only is colon cancer really common or one of the more common cancers that's affecting Polynesian communities, but when Polynesians are discovered to have colon cancer, usually it's found at stage 3 or stage 4. It's found a lot later in severity. And so, it's kind of important to try and to reduce finding at that stage, and hopefully we can help our people find it way earlier in stage 1 or stage 0, so we can prevent it from progressing even worse. But yes, thank you guys for giving me some time. I appreciate you guys, and thank you for all you do for the community.
Thank you so much, Luti, for using your voice and your medical expertise to educate our people. We really, really appreciate it. And I feel like if even 5 families go out and have their parents and those within the age range to check and get, in better health, and to even increase in some of these things that will include that will help prevent these types of cancers, I feel like that's a win. So thank you so much for joining us tonight. I really, really appreciate it. Okay, Epe, thank you so much for patiently waiting while we're just going over and educating what colorectal cancer is. I wonder if you would be willing to share, how you and your family were impacted by colorectal cancer.
So on when was it? My mom was diagnosed with colorectal cancer March of 2020, and she was diagnosed at stage 4. And we were really devastated when we found out she had it. So yeah, it devastated our family when we found out she was diagnosed at stage 4. Too late to cure at that point, but was offered chemo to help her to prolong her life.
Oh,
Sorry,
thank you so much for sharing. I guess as I'm sorry about your mom. I wanted to ask if for your family, if you guys had seen, like, now that did you guys see symptoms in your mom kind of leading up to that?
So a couple years prior to that, she slowly started having what Luti described as the symptoms, whereas she had a lot more bloating. Fatigue slowed her down a lot. So when she would babysit a lot of our kids, she would be resting more than usual, napping more than usual. She had constipation problems. She had a lot of the symptoms that Luti listed earlier. But yeah, those were her main symptoms, was constipation, and then she wouldn't eat a lot. So she was losing a lot of weight too, on top of that.
Yeah, all of those were all symptoms that Luti kind of mentioned.
Yeah.
The symptoms for colorectal cancer. So she was losing weight, fatigue, bloated. That's so hard. Like now that you've seen the impacts of colorectal cancer. What preventative measures have you taken and your family taken with regards to colorectal cancer?
So I had, before she passed, I had actually set up to get my colonoscopy done, of course, to just check. Now that we know that she had it, we were thinking it is hereditary and we need to all go get checked. My siblings and I, and there's 6 of us. So 3 of us have already gotten it done. I did have some polyps, but they were benign. So I have to go back within 3 to 5 years. My sister, who was the 3rd oldest, got her colonoscopy done. And from her polyps that they found, they were precancerous. So she has to go back every year. So luckily, from those results, she went back this past year and there was nothing found. So they told her she can come back in 3 years. My brother, who is after me, he got his colonoscopy done and his were benign, the polyps that were found. We're still trying to get the other 3 to get theirs done. But yeah, those are the preventative measures that we've taken with this happening with our mother. And we also went and took our dad. And luckily he doesn't have any polyps either, or any, he has benign polyps. So that's helped us a lot with making sure we prevent this from occurring again within our family.
Wow, great action to try and prevent it from
Yeah.
spreading. I did have a question. I hope this isn't too personal.
Oh,
Can
no.
you tell me how old like you and your siblings are that have gone and gotten checked and had your colonoscopies completed?
I'm sorry, how are we what?
How old are you guys?
Oh, yeah. So I'm now 38. The one after me, Hinkley, he's 37. And then my sister, the 3rd one that went and got hers checked, Leafy, she's 35.
Wow, so
Pretty
that's
young.
yeah, that's crazy because I feel like, I mean, when I was reading over things in order to um, like preventative measures in order to get
Yeah,
checked for colorectal cancer, the colonoscopies, I believe the suggested age to get colonoscopies is
50.
50.
It's
Yeah,
50. Mhm.
that's crazy. So, which means that, yeah, it's hereditary, right? So,
Yeah.
because I mean, you still have polyps, which is crazy, and
Mhm.
you really don't know.
Yeah.
And look at how young you guys are, and it's already kind of in your track. You know what I mean? That's just insane.
Yeah,
So,
for my sister to have precancerous polyps, I'm grateful that, I mean, not for the incident that happened with my mom, but I'm grateful that it's helped us to realize, and it's a wake up call for us. The age is getting younger. So we do have to get on top of it and go get a colonoscopy done.
yeah, and even though your sister is 35, still having to get checked every year, that's really, I mean, it's lucky that you guys went in so early, huh? Because
Yeah.
I feel like even at a young age, it could already be developing and just get cancers later on. So, yeah. So when you found out that your mom had colorectal cancer, you guys had these preventative measures that started much earlier, even though the suggested age for colonoscopies is 50, which is crazy.
Mhm.
Um, Not knowing what you and your family have experienced regarding uh, now knowing what you and your family have experienced regarding colorectal cancer, something to eat tonight.
What I would like to share with our community is that we need to get on top of getting checked for this cancer. It's an ugly disease. Um, it could have been prevented if my mom had gone in earlier, but again, Polynesians, especially the older generation, they're kind of stubborn and set in their ways. Um, they don't feel like they need to go to the hospital, or they're scared to go to the hospital to go get checked. Was one of the reasons why my mom didn't want to go. And they go in when it's too late, after it's already spread. And that's what happened in her case. It was at stage 4. So my advice, and something I want to leave with our community, is we need to go now and get checked and stay on top of our health. Eat healthier, cut out the fats, the animal fats that we like to eat, and exercise. Physical activity is another big thing that we need to get on top of as Polynesians, because we are bigger than the normal person. So we do have to get on top of staying physically active to stay healthy. So I really advise that we do go. It doesn't have to be 50, that's the recommended age, but this is, if it's caught early, then it can be prevented. You can get cured if it's caught early.
And I'm sorry I didn't include this, but I feel like one of your points, just to close out tonight, was that sometimes our elderly are scared.
Mhm.
I wondered, and if it's too personal, that's okay, but I feel like I need to ask this.
Yeah.
Can you share for yourself what the process of getting your colonoscopy, and were you in pain afterwards? I guess I'm just also like, I'm sure there are other people that are curious, like,
Curious. Yeah.
yeah, if it's painful, if you're in, like, what happens, what's the process?
So you get put on a special liquid diet prior to going in to get the procedure done. Once you're there at the doctor's office, it's pretty quick. You go in, get put under, and it's one of the best naps ever. Like, I woke up with drool all over my face. It was one of the best. I'm a mom, so that was one of the best naps ever that I had. And my sister said the same thing too. So it's, you're afraid because you don't want anyone down there by your rectum or colon,
Yeah,
is one of these, is a lot, like one of the main reasons why people are probably too mild or too afraid to go.
yeah,
However, if it's to help prevent cancer, then why not suffer a couple of, discomfort, like minutes of discomfort, versus a whole lifetime of being stuck with cancer if you don't go in and get it done. So
yeah,
yeah, it was worth it. It was worth the discomfort that I had in that moment. But
yeah.
that'll,
And lucky that you guys went in, because you all still did have polyps, right?
yeah,
So
we had
that's, I mean, you think of how young you guys are, all under 40, and I'm like, that's crazy, which means,
yeah,
there is a hereditary factor that weighed into you guys. And so I feel like that's such great information. Thank you for kind of, I think, helping us understand the process is not so scary as I think
it's
people, I
not.
know, I think a lot of it is people just don't know, right? Like,
Yeah,
they don't know, um, how invasive is the colonoscopy, but like hearing that we're going to take a nap, like, that makes me feel much better. I feel like, personally, I hope people here who are listening and people who are listening in the
yeah,
future will know that it really is a seamless procedure, and it's
yeah,
not painful, but I think that that's so important to know is, like you said, if you can get this procedure done very quickly with
yeah,
basically no pain, to protect you and your family and your health, I feel like that's the
yeah,
end goal. So I love how you shared that. Thank you so much for being on here and sharing. And I hope that, I know there's a lot of community members here in Utah that have been severely impacted in the Pacifica community,
mhm,
with this specific cancer. And um, I'm so sorry about your mom. And
thank
I
you.
really, really appreciate you educating people, because I really feel like this will be far reaching. And for UPIC table, we love to have the professionals come on, but I really feel like our community, um, can relate more to everyday families. And I feel like, you give a voice to people who I feel like need to hear, like, I gotta go get my parents checked, because
Yes,
1 month, 1 year could be the difference between
could be
catching it
different.
early stages to versus late stages. So
Yep.
thank you so much, Epenesa, for your